Carpal tunnel syndrome is a condition I see very frequently. It's a nerve compression. Specifically, the median nerve, as it passes through the wrist, runs through a very tight tunnel. And with use and age and time, carpal tunnel syndrome can occur where there's compression of the nerve. And so just like if you sit on your foot and your foot goes to sleep and you have that numbness and tingling, this compression that occurs at the carpal tunnel causes similar nerve type symptoms, numbness and tingling that occurs usually in the fingers, most commonly thumb, pointer finger, middle finger, and ring finger, because that's the fingers that the nerve supplies. Oftentimes people will notice it during specific activities. Most commonly that would be like it wakes them up from sleep at night where their hand is numb frequently or burning, tingling, they have to shake it out, reposition things. They'll also notice it when they're holding a book or a magazine or a hymnal in church, if they're holding their phone up for a period of time, gripping a steering wheel, driving for a period of time. Women sometimes will notice it when they're putting on makeup or they're blow drying their hair. Anything that requires sort of sustained gripping, pinching for an extended period of time is what tends to cause the symptoms to become more noticeable. Initial treatment for carpal tunnel syndrome is usually non-surgical, and that basically includes sleeping in a wrist brace at night. And so many times if the symptoms are early or mild, just kind of starting, that's a good place to start. Oftentimes we'll send patient for what's called a nerve conduction test, where it's usually done by a neurologist or a physical medicine doctor. They place some stickers on the arm. There are a few needle sticks that are involved as well, but it helps us really figure out everything we need to know. It lets us know where is the site of compression. Is it at the neck? Is it at the elbow? Is it at the carpal tunnel? But then additionally, it tells us how bad it is. So it gives us a severity measure. And that really tells us, is this something that we can continue to treat non-surgically with therapy, bracing, activity modifications, medications, maybe steroid injections? Or are we seeing really severe signs of nerve compression leading to nerve damage, and then we need to think more seriously about a surgery, and that would be the carpal tunnel release surgery. Carpal tunnel syndrome is, I would say, one of the most minor and also most successful surgeries that I do. It's very frequent in my practice. It can be done under straight local anesthetic in the clinic setting for some patients if they're amenable to that, or patients who maybe have a lot of other medical problems and aren't really a good candidate to undergo safe anesthesia. They may choose to do it as a straight local type procedure in the clinic setting. Other patients, we do it in the operating room as an outpatient surgery, where we might just do a twilight sort of anesthesia with some sedation and some numbing medication. Either way, we're typically able to avoid a general anesthesia and still have the patient very comfortable. The procedure takes about 10 to 15 minutes to do. There's just a small incision in the upstream aspect of the palm, just near the wrist crease. The nerve runs through a tunnel in everyone. And so what we're doing technically is just opening the roof of the tunnel to take the pressure off the nerve and give the nerve more room. And that's often very successful at immediately getting rid of their nighttime symptoms and getting them better rest at night, and allowing that numbness and tingling that occurs during the day to resolve as well.